Hi, I'm Dr. Jelen Israel Civic with Premier MD Care, an internal medicine concierge practice here in Fort Myers, Florida. So today I want to talk to you about menopause, something that every woman has to face, and I know a lot of women talk about it. So what is menopause? Menopause is really a natural biological process that marks the end of a woman's menstrual cycle. So around a woman when she's in her 30s, menstrual cycles start to change a little bit, and you start to make a little bit less estrogen and progesterone. And then when we're in our 40s to 50s, or 40 to 50, our periods can get either very heavy and irregular, can occur more frequently, or it can get very light and sporadic. And usually in the United States, most women are postmenopausal or have gone through the change by the time they're 51 years of age. And the perimenopausal phase, which is the symptoms of menopause arriving, can go on for 2-3 years or even longer before your period actually stops. So once your period has stopped for a full 12 months, you have technically gone into menopause. How else would you know that you've gone through menopause if you have those sporadic periods here and there and you're wondering if you are in menopause? Blood work can be done. It's not always necessary because you can really go by symptoms, but you can have blood work done to check your hormone levels, and your FSH level would be high, your estrogen and progesterone levels would be lower than normal. So what are the symptoms of going through menopause? And I'm sure if you asked any woman, she could tell you right away. The number one symptom is hot flashes, where you feel like you are radiating heat from the inside out, and your head and neck and face get really hot and uncomfortable. Night sweats are another symptom, which can lead to a lot of sleep abnormalities, which causes and leads to daytime fatigue. There are mood disturbances. Vaginal dryness is something also that women complain of because of the lack of estrogen, decreased libido, and thinning hair and weight gain as the metabolism starts to slow down a little bit. So those are the symptoms, but there are some complications that can happen with menopause or when menopause arrives. One of the top complications is the increased risk for cardiovascular disease. So cardiovascular disease or heart disease is the number one killer of both men and women in our country. So for women, we tend to have kind of a protection with estrogen up until we go through the time we go through menopause. And then after that, we kind of catch up with the incidence of heart disease with men. So we have to be very careful with our diet and with our exercise and the choices we make with food to make sure that we don't increase our risk of cardiovascular disease. Another thing that can happen with menopause is that because you lose your estrogen effect, your bones can become weaker or thinner, and you can develop osteopenia or osteoporosis. This can increase your risk of developing fractures with mild trauma. Another thing that can happen is urinary incontinence, because the tissues in the vaginal area and around the urethra lose their elasticity due to lack of estrogen. So women will complain of having urgency and frequency and not being able to hold their bladder until they can make it to the bathroom in time. Another thing that can happen is the sexual dysfunction, because the lack of feeling is not as intense as it used to be, and due to the lack of lubrication, that affects a woman's sexual life as well. So how long does menopause last? That can vary from woman to woman. Some studies say from 7 to 14 years, some studies say from 4 to 5 years, but oftentimes we tend to have the symptoms about as long as the way our mothers did, probably. And the most common symptom, as I said, is hot flashes. So what can we do to treat the symptoms of menopause? Because women do become miserable with all the symptoms that we've talked about, with the hot flashes and the insomnia. So you can take hormone replacement therapy. However, after the Women's Health Initiative study back in 2002 was discontinued due to finding out that synthetic hormones can increase your risk of breast cancer and cardiovascular disease and stroke. Since then, now we're very careful not to prescribe these synthetic hormones for more than 5 years to help a woman transition through menopause. So what are some of the other non-traditional ways of treating the symptoms of menopause? You can use topical estrogen creams, but those are also synthetic. You can try also, there's vaginal rejuvenation. I'm sure a lot of you have heard about that and wondered what that is. And that's a procedure that we do right here at Premier MD and Med Spa 22, where we have a radiofrequency ablation machine, which actually heats up the tissue to a certain temperature that helps to increase its elasticity and collagen production, and tightens the skin up in the vaginal area and around the urethra, so your vaginal dryness can be improved, your ability to for sensation is improved, as well as the urinary incontinence symptoms can be improved with this procedure. There are no risks with this procedure, so that's one option for a woman. Another thing that can be done is even hormone pellet therapy with bioidentical hormones. We do that here as well. These have been proven safe as opposed to synthetic hormones to help with all the symptoms of menopause, but also importantly, the long-term benefits are the reduction for the risk of breast cancer, heart disease, and stroke, and diabetes. So there are traditional and non-traditional ways to treat menopause. So if you think you're going through menopause, talk to your doctor and help he or her guide you through this change in your life. Thank you.